Welcome to the Black Trust Podcast. Where we look at how the pivotal core capacity to trust will determine how African Americans show up in the movement to build a multiracial democracy, whether we are categorically diminished to survival mode or strategically and resourcefully innovate a pathway toward thriving. I am your host, Pamela Boyce Sims. I'm a clinical herbalist and wellness guide, practicing complementary integrative medicine.
If you cure somebody who has cancer that was not going to kill them, that's a pretty easy cure.
Welcome to an episode of the Black Trust Podcast entitled The Inside Story. What Black men are not being told about prostate cancer risk reduction, treatment, recovery, and resilient living. Shortly, we'll hear from the Senior Advisor to our Men's Holistic Health Project, Dr. Otis Brawley, who is the Bloomberg Distinguished Professor of Oncology and Epidemiology at Johns Hopkins University. But I'd like to take a moment to share a quick story told by Dr. Brawley in his book entitled How We Do Harm. A doctor breaks ranks about being sick in America, in which he talks about how the medical system really views men who dutifully attend prostate cancer screenings. This story is about a conversation Dr. Brawley had with a medical marketing person at a cancer screening event about his business model. The medical marketing rep proudly recounted that of any given 1,000 men 50 years or older at your typical free mall or church health fair screening, 145 would have an abnormal screen. 10 wouldn't have insurance. The 135 remaining men would investigate the abnormal screen, and of those, 45 would have cancer. That medical marketer could accurately calculate the number of men who would have radical surgery, prostatectomy, how many would get radiation therapy, how many would get hormonal treatment, would have incontinence so badly that they'd opt to have an artificial sphincter implanted. He knew how many would experience erectile dysfunction and want Viagra, and also knew the percentage for whom Viagra would not work, and how many therefore would want penile prostheses. When the medical marketer was asked, how many lives will you save as a function of screening those 1,000 men? The marketing rep responded, "You've got to be kidding. Don't you know? No one can pinpoint if any of those lives will be saved. I can't give you a number on that." The mega profits in overtreatment, unnecessary procedures, drugs, and medical devices that cascade from a free health fair, mall-type screening, pad the bottom line of a long chain of medical businesses and is measured down to the very last penny. The system is structured in such a way that it encourages expensive overtreatment and unnecessary suffering with very little patient benefit. With that said, I'd like to introduce our guest, Dr. Otis Brawley, the Bloomberg Distinguished Professor of Oncology and Epidemiology at Johns Hopkins University. Dr. Brawley is a renowned authority on prostate cancer screening, treatment, and health disparities. Dr. Brawley served as the Chief Medical and Scientific Officer and Executive Vice President of the American Cancer Society from 2007 to 2018.
It's wonderful to be here, and I wanted to talk about a little further about what Dr. Boyce Sims said in my book. That marketing guy knew how much he could make off of prostate cancer screening, how much money, but he, actually knew a truth. And so important that we realize that there are many things that we've done in medicine because we thought it might be good, and then we found out it was not, and it was actually harmful. The other reason why I have been so outspoken is right now I'm actually in Kensington, Maryland right now. There's a group of urologists in this area, a large group of doctors who regularly pay Black ministers $2,500 to get the podium on Sunday, and then go get in front of the congregation. They especially start talking to the women to encourage their husbands and their men to go get prostate cancer screening. And what history tells us is for the longest time, Black men have not been respected and Black men have not been told the truth. Sometimes they've not been explained the truth. I'm going to tell you a truth right now. Don't tell him that it's like mammography for breast cancer or pap smears for cervical cancer or the numerous colon cancer screening technologies, or spiral CT for lung cancer in people who have smoked. All of those, we have science to show that those interventions prevent people from dying. Part of the problem with prostate cancer is there is a large number of people that have prostate cancer, and it's a kind of cancer that we don't talk about much. It's a kind of cancer that, if never treated, will never kill you. If you cure somebody who has cancer that was not going to kill them, that's a pretty easy cure.